long time since you left me. I didn't mean to make you cry. I didn't mean to disappoint you.
So we're up live, and you can find us on EduFM, that page, and you're going to see the doctor, the gorgeous doctor in the studio, Unique Chung, and we'll be talking about tuberculosis, as I said, and how we're going to stop it, or how we can stop tuberculosis.
Tell you why. One more.
So guys, share the live. Let's get a lot of people, as much as people that we can on this live. It's a really interesting topic.
Try, let me put my arms around you. Living all these lonely nights without you. Oh baby, can we give it one more try?
You're listening to EduFM, the home of family edutainment.
It's been a long time since I kissed you. It always used to feel so good. And if you knew how much I missed you, you'd forgive me if you could. And now that we have found each other, can't we give it one more try? One more try. I didn't know how much I loved you. One more try. Let me put my arms around you. Living all these lonely nights without you.
So we're going to get in right into that talk, and I'm going to introduce Dr. Unique Chung. I want to say a very good morning to you, Dr. Unique. Did I pronounce that name right?
Yeah, you did it right.
Okay, thanks. So tell me, how long have you been in the medical field? How long have you been a doctor?
So I graduated in 2017, so that's 6 years. So.
Wow. Okay. You look pretty tiny for a doctor. I was thinking you're a schoolgirl walking in the studio here this morning. And you're from Jamaica.
I am.
You're Jamaican.
Yep.
Okay, so when I come over to Jamaica, I could come visit you.
Yeah, we go to the beach.
Oh yeah, and I love your accent. I love Jamaican accent. All right. And what about the foods over there? What's the favorite dish over there? What's your favorite dish?
It's not just one thing.
Oh,
I have a list. I always say when I go home, I have to go to Devon House. I need Devon House ice cream.
Wow.
I need tasty patty and cocoa bread.
Then
Then after you go to Gloria's and you just have some fish, escafish, steamed fish with festival.
Man, you're making me so hungry in the studio here today, man.
Yeah, every time I think of home and the food, I just like, oh, I'm hungry. I want to go.
So you miss home.
Every
Yeah,
day.
well, they say, we would all miss our home. Our home is,
Yeah.
where we groomed ourselves and we become so accustomed to the basic, like your foods and stuff like that. But welcome to Guyana, and I want to say thank you so much for coming on the show today. And can you tell me what inspired you to choose this field? Because we're talking about tuberculosis, and you said you're specialized in chest. You're a chest doctor, right? What inspired you to do this specific? I know you're probably studying other aspects of medicine.
Why TV? And
Yes,
that's a
why?
really good
Why?
question because everyone's like, why do you choose something
Yeah.
that's so contagious?
Right.
So, to be honest, TV chose me.
TV chose you.
Yeah,
Well,
not-
this is gonna be good.
Not that I had TV or have TV.
Right.
In the final year of my master's, I chose to do my thesis on tuberculosis. And I met with Dr. Mohan Lal. He's a really great doctor. He's the head of the program. And his love for TB, when he was explaining the different things to me and what to look for, talk about the patients, I realized that I could help in TB.
Right.
Because I started doing family medicine because that's my thing. I love interacting with patients, interacting with people, changing everything.
Wow.
Because my personal motto when it comes down to health is that everything is in the soil. So if we can prevent it, why not try and prevent it?
Wow, that's really nice.
So he, like me, like herbal medicine. So we started to talk about different herbal remedies and what he thinks patients could do and how he interacts with patients and his relationship with his patients. And I realized that I like this. It's not just an infectious disease. It's a relationship that you have with the patient. It's
Right.
teaching the public something more than just, oh, you're sick.
Right.
So it shows me, and I
It
like
shows
it.
you. It's good that it shows you because there's a lot of people, and for instance, right now there's a common cold going around, a cough, and it's not one person. It's something that's really going around. A lot of people are troubling with cough and the dry cough. And well, right now, as I'm speaking, I've been hoarse for quite some time, and I'm hoping it's not TB. Okay, but I know if it is, it's treatable,
Yes,
right?
it is.
Let's get that out there to the public that TB is something curable. People tend to
Yes.
think, oh, they're done.
Now we can cure cute TB. We can stop TB.
So let's get right into the talking about TB. What is TB? And yeah, go take the floor, doctor. And you said your name is Dr. Unique.
Yes, unique gray chung.
Great Chung.
Yeah, I added on his name.
But I don't see any gray hair.
It's there. It's just
It's
hiding.
And which hospital can we find you, Unique?
I am at the Region 3 Chest Clinic. That's at the West Demerara Regional Hospital.
Wow.
West side, the best side.
West side is the best side. Yeah, I keep hearing that. I'm definitely going to come over to the west side to see how best it is.
At the best hospital.
Yeah, so let's get right into it. Yeah, the floor is all yours. What is TB though? Let's get into that. What is TB?
Okay. So let me start by saying why I'm here for talking about TB this specific
ahead.
week is that this week at the Region 3 Chest Clinic, we are actually doing 1 week of activities observing World TB Day, which will be on Friday, March 24th.
Wow.
So a part of that is that as a clinic on Monday or during the week, let me not go in specifics, we are testing and sensitizing staff, meaning we're talking to staff about TB because it's a hospital and a lot of us come in contact with a lot of TB patients. Some of us are exposed and do have positive TB tests. We also will be in Parika on Tuesday talking to the community about TB. Especially now that we're seeing an increase in cases, we need the community to know this is what's happening. If you're seeing these symptoms, look out for it.
Right.
Because persons are no longer wearing masks anymore. COVID was a good thing. Everyone was wearing a mask, but now no
Truly.
one, they're not wearing a mask. People walking around with TB, and unfortunately, we're seeing more cases. So let me go into what TB is. So layman's term, it's an infectious disease that is spread from person to person. So if I'm here talking to you right now, no mask, and I have TB, which is a possibility. I don't have TB.
I know.
But it's a possibility because I'm so exposed to
Right.
a lot of patients with TB. I can easily pass it on to you by just talking to you, singing, coughing, just being in this room because it's airborne and it's very easy to catch.
Man, you're making me a little scared now. Let me interrupt you there. So simple talking and breathing in can give us this.
Yes.
What about our body resistance? Let's just say our body resistance is really strong, really up there, and we're simple talking and breathing in. Can our body resistance being so strong fight it off? We can't.
Yes.
So having a good body resistance is a plus. Building up
Having
yourself,
a good body,
eating good.
eating good, eating healthy, no
It-
fried food. But we in the Caribbean, we are vaccinated against TB at
Oh, wow.
birth, so we do have additional help in our
Good,
bodies to fight
good,
against it.
good.
But as you increase in age or you have any immunocompromised disease or illnesses, your body does become weak, and then it's harder for your body to fight against this bacteria. So if you're just sick, you're not sleeping, you're not eating, you're not resting, your body is weak, your immune system is weak, and it's harder for us to fight. So someone coming coughing around you on a sick day and a weekday, you'll now contract TB.
Yeah.
So if I test you with the skin test, which I'm going to explain further, you may actually have a positive reaction because you had the vaccine and because more than likely you've been in contact with someone, knowing and unknowingly with TB. So it's not that we're all free of it.
Right.
It's very common. So some of the symptoms that we can look out for, and don't get nervous. Because I know you're not
already
well.
getting me nervous because right now I don't have a voice.
So I know you're not well, but it's not TB. We would see patients that would complain of a cough for
Right.
3 weeks.
Wow.
They would have unusual fever, dark fever yesterday morning, then had it last night, and I had 2 days ago. So it's not like, oh, only in the nighttime or only in the
Right.
morning. It's very unusual. Then they'll have talk about night sweats. They'll say, oh, they got to sleep and they wake up and they're completely wet,
Wet.
night sweats.
Wow.
So, and in some cases, they have patients who tell they're coughing up blood. So
Wow.
normally you can cough up on a cold, because normally I ask what color is a cold.
Right.
But some cough up blood, like hemoptysis we call it, it's blood. And then they feel really weak and tired. That's a common complaint with TB patients, they just feel tired.
Mm-hmm.
So for some people, they're like, no, I'm fine, I've just been working a lot, that's why I'm tired. And when you look further, they have TB.
Right.
So we need to not just blow off our illnesses to say, is that cold or just tired or working out. We're
Right.
working out and losing weight. It's actually, these are signs of TB, not just COVID. First time we think, oh, it's COVID. But we need to realize that TB is still there and we need to focus on TB as much as we were focusing on COVID. Because yes, we can end TB, but we need to work at it.
Yeah, but some people, even though they're seeing these symptoms, they kind of brush it aside, as you said. Oh, it's a simple cold. I need you to tell them how dangerous TB is, and TB is a killer. Let's talk about that. Let's let the listeners or people who are locked into the radio know that brushing aside these symptoms and can cost you your life, because it's something that kills you. It takes the immune system.
It does.
It really breaks it up, breaks it down. So let's talk about that. Not brushing aside these. If you're having these symptoms, get yourself checked, and it is treatable. You said it is curable. All right. So yes, guys, if you know you're having cough and these kinds of fever and sweats and you're seeing blood, and the coughing, you said, is for a period. If you're coughing too much, like for
Yeah,
3 weeks
3 weeks.
non-stop, and this coughing is be aggressive coughing, I
It
can tell you
starts
that
off with a very simple
because
cough, but
I,
gets worse.
I had a family member who had it that's very close to me, and luckily none of us, her kids or my mom actually, none of us had it. She had it, and we were all living with her, me, my sister, and my dad, and none of us had it. But she got her treatment and she was on it, and she's cured and stuff. So I know for a fact that it's curable, it's treatable, and if you can be living with someone with TB and not have TB because you choose to live a good, healthy lifestyle. Your immune system. So we need to get that out there, guys. Build your immune system. Get your rest. Stop stressing your body. Stress breaks your immune system down. Ensure you're eating healthy. Keeping a good mental state as well. So yes, doctor, let's talk about how we can cure TB.
Okay, so I will talk about what we do to test for TB
Go
and
ahead.
then the treatment, because I like that you mentioned the treatment
Yeah.
and it's something that patients need to follow. So what we do when you come and say you have these symptoms, we would do a simple mantle. It's a skin test. What it is like a tuberculin. We put it underneath the skin, and in 2 to 3 days you come to do a read off. It is
Right.
when we measure the reaction of the tuberculin in with your skin.
Wow.
If it's over 10 and you're a healthy person with no autoimmune disease or immunocompromised disease, then we'll be like, okay, we need to do further testing. We would do a sputum test. That's when you get up early in the morning and spit up all that cold. And you put in a container and the lab would test it. And we also do a chest x-ray. This chest x-ray, sometimes you'd have negative sputum, negative skin test, and your chest x-ray just screams, I have TB.
Wow, are you kidding me?
Yeah.
You can have a negative skin test and a negative spit test, and still you have TB. So it's advisable to do everything, do all the
Everything.
tests to make sure.
Yeah. So if you're just having these symptoms, because there's some persons that for some reason would come back with a negative skin test, not sure why. And there's some that are delinquent and don't come when they're supposed to be checked.
Right.
But I have seen patients that even for the spit test, they will tell you it's negative. But we have to realize it's all human error. So a
Right.
lab could say it's negative and it's still positive. We've done stuff where you say, no, you don't feel good, but the test say you're normal. And it could be where it's just an initial stage. So not everything's going to come out the way you would expect it to be. Then you start feeling sick. You look on the x-ray and you see like a capsule there in the x-ray.
Right.
So we have to focus on everything. And once we see these things that are positive, especially if everything is positive, we would do further testing and start you on treatment. So there are different types of treatment. If you just have a positive skin test and everything else is negative and you were in contact with someone with TB, we will treat you with preventative treatment.
Right.
So you do not become ill because you have latent TB. It's
Wow.
inactive. It's not doing anything. It's like a lazy bacteria just chilling in your body, not doing much.
Okay.
But when you have active TB, it's like a big fight to saying, yeah, I'm going to terrorize your life. I'm going to make you tired. It's very active. So when you have active TB, that's one that we're really concerned with. That's one we'll treat with a 4-drug combination in the first 2 months. In the first 2 months, patients start to feel better.
Right.
Patients stop taking their medication. And they say, oh, doc, I was feeling better. I didn't come back. Stop taking the medication. Then a few months after that, they come back sick, sicker than they were before because patients are not complying with instructions taking their medications, which is something I want to emphasize, that we really need patients to take their medication, not just for TB, for any illness. Complete the time given, because we're giving it this time not because we're bored or we just want to see, oh, let's see how the medication works. Your body needs time to
Yeah.
recover. So you're going to start feeling better. That's good.
And that's a good point you make, you know. A lot of people, and I personally know some, that takes their medication. It doesn't matter what illnesses they have. And as soon as they see they're feeling better, they stop it.
Yeah.
And that shouldn't be. It should be you run out the course. I'm happy that you said that. And there's also another factor. They should be taking it on time. Let's say every 12-hour apart. You know, some people don't do that.
Yeah.
Taking your medication on time and the full course out, if it's 2 months, 3 months, it really does make a difference. And a lot of people really don't do that. But I wonder why, doc. I was
Well,
wondering why they
For
don't do
my
that.
TB patients, when you have active TB, active pulmonary TB, because you have pulmonary TB and extra pulmonary TB, so you can have TB in other parts of your body.
Right.
So when it's active pulmonary TB, you have treatment for 6 months.
Wow, that's a
Nobody
long,
wants
yeah,
to
yeah,
take
yeah.
medication for
Yeah,
6
it's
months.
a really long course.
Yes. And if it's extra pulmonary, because we do have patients that they'll probably do a biopsy, a bone biopsy, some kind of biopsy, and have TB outside of the lungs, then they have 10 months to a year of treatment.
Yeah. Wow. So maybe it's a length, but it doesn't matter. It doesn't matter. It's not a lifetime of treatment. Even if it's 6 months or a year, it's going to be done at some point. So they should. And you have a lot of problem with your patients taking their medications or taking it out of the course.
You have no idea. But we have DOTS worker, which is a direct observational therapy. These workers are persons that work along with the TB program. They'll go to your home
Wow.
and they'll be, okay, Anne-Marie, you're supposed to take 3 tablets today. They're giving you these 3 tablets and watching you take these tablets to make sure you took the tablets. And they stay with you up until the end of your treatment to make sure you're taking the medication, make sure you get your test done. So that's an additional help.
That's
when we
really
can't
good.
be
That's
there.
really good. So that's really good, man. I didn't know that.
Yeah.
So you're not just giving them and they do what they want. You guys are implementing. You guys have implemented something where these
DOTS workers.
go out and ensure that these patients are drinking their.
Yeah, so
Well,
they
that's a
have
lot of
their
work on
bikes.
your end.
It's a lot of
But it's all about making sure
managing
that
But once you can establish them, this is what I need, this is what has to be done, they will take their bike and they're given the list of patients, because the West Coast is pretty big. So we have different DOTS workers for different areas. So they'll take their bikes and they familiarize themselves with the patients and the patient's family.
Wow.
Because sometimes the patients not feeling up to getting up and seeing them. So even if they can't physically give them, I would say, you have TB, I give it to your sister because I'm entrusting her to make sure that you take your medication.
Right.
So we do that because it is hard on patients, especially in the first couple months. They're not well, they're not feeling good. It's hard. So we give them a little extra help.
Yeah. So we were talking about how we can end TB. What is it we can do? Or
We need to take all the necessary precautions. if you know someone around you has TB, wear your mask. And if you have TB, wear your mask.
Correct.
It is airborne, so just talking, as I said, is going to spread it. Wash your hands constantly. Main thing. Wash your hand. You touch a surface, wash and clean your surfaces. Be careful and be vigilant of the people around you, their symptoms. And if you yourself have these symptoms, go and get it checked out. It may be nothing and it could be something. So if it is something and you know, make the change. Be that person that's going to say, I'm going to take the step, go and get myself checked. I have TB, I'm going to wear a mask. I'm going to distance myself from people. I'm going to constantly wash my hand. I'm going to encourage persons to wash their hands. A lot of persons, when they end up having TB, they're like, how I get this? I don't do anything. I'm not around anybody. But you probably went in a taxi, went home,
or in a
do
bus.
everything, touching your face, never washing your hand. Nobody's wearing a mask anymore. You're not wearing your mask, so you can't really fight someone else for not wearing a mask. So we're putting ourselves out there to be infected.
Mm-hmm. And you said it's airborne, so we can just be walking and just breathing and rebreathing something, and that's it. We got, so, I mean, as much as I'm not wearing a mask right now, it's something that we should continue doing. I mean, for for our health's sake, there's so much airborne diseases apart from TB that we can just breathe in.
COVID isn't done. It's
No,
still
COVID
around.
isn't done. That's for sure. But a lot of people are brushing it aside for some reason. They think because we haven't, I don't know, it's not here, but it's still here. It's still around, right? So, and you were telling me about World TB Day, and let's talk about that. Let's refresh where you guys
So-
are gonna be. And
On Tuesday, we will be at the Paris Castellan. I hope to see a big crowd for community sensitization, which is just us teaching the community about TB. What is TB, the signs and symptoms to look out for, and how to prevent TB. We'll also encourage persons that actually have symptoms or know someone with these symptoms to come to the clinic where they're every day. Come and get tested. Let us check you out. Even if it's not TB, we will follow up with you because we care. We don't only look on it's TB, you don't have TB, go away. You have a chest infection, we started seeing you, we will continue the process to make sure that you are better.
And let's talk about what does TB do to you, so people can actually know. Listen, if you don't treat yourself or go and check yourself, what does it do to your chest? I mean, it has to be making you uncomfortable. It has to be doing some kind of. It has to be really upsetting you, and you're coughing all. What does it do inside of you? What?
So it damages the lungs. It causes
Exactly.
fibrosis. As if, when you fall down and the Guyanese word is a whitey, and you get a whitey
Yeah,
and the whitey starts healing and
Yeah.
all that. So that actually happens when it's in your lungs, the bacteria goes and it forms a capsule in the lungs and everything forms. So you'd actually have different capsules in the lungs and scar tissues. So
Wow.
it's damaging the lungs.
And it's harder to breathe too,
It
is
is
it?
extremely hard for patients to breathe. We try to give them medication to help with breathing, but it goes from you walking and fighting for breath, and you have patients that are wheezing, to patients just sitting down and can't breathe because your lungs is literally being damaged. If you're not taking the treatment, you're damaging your
Your
lungs.
lungs,
And this
yeah.
is only if it's in the lungs, because as I said, you have extra pulmonary TB, which means it's outside of your lungs.
Mm-hmm.
So we've had patients that had TB in the spine, so they could not walk for months until they got the treatment, and then little by little they were able to walk. So we need to
Wow.
realize that it's not just your lungs that you're damaging.
Wow,
It's
I
other
didn't
parts
know
of your
that. I
body.
didn't know that. It's
Yeah.
different parts of your body, so it's something that really you need to, because if you can't walk, if it's in your spine, then that's a
Yeah.
life-threatening illness there.
You have the spine, you have in the cervical column. It is a lot.
It's a lot.
So I think people need to realize that TB is TB, and it's not just a cough and a cold. Could be anything that you're not even expecting.
Mm-hmm. Is there anything else you want to add to our talk here? I think we would have covered everything, but I don't know. You have to tell me if there's anything, or you want to talk. Shout out to anybody, any doctor out there, your mom, your kids. The floor is all yours.
Oh, my kids are there somewhere making noise.
So you have twin, you said,
Yeah,
right?
a boy and a girl.
Wow, congratulations.
Thank you.
They have you busy or not busy?
Oh, this is an understatement. I
Ah,
don't know what other word I could use, but
twin.
it's more than
But
busy.
I would have loved to have twin.
And
I
the
have
twins,
one.
right? Everybody's like, "Oh, you good?" boy and a girl. That's it.
That's it. Yeah, that's definitely it.
Yeah, but then you have some that say, go again. And maybe get triplets.
Yes, that's true. It's society. It's society. When you're getting the next one, when you're marrying, when you're doing this. So, do you want to shout out to anybody that's out there that's listening? Your team down there at the clinic, your mom, your dad, your husband.
I guess I will shout out to the West Denver Regional Hospital, all the
right.
staff there, especially the staff at Region 3 Chest Clinic. We are doing a good job and we can do better. And I believe that we can, yes, we can end TB.
Yes, definitely we can. We can do anything once we put our mind to it and hard work. And we can and we will end TB. Let's say we will end TB.
End TB.
Yes. So I want to say thank you so much for coming here this morning. It's such a pleasure. You're such a humble, beautiful soul. You walk into the studio and I was like, I was just, wow. And I want to wish you all the best here in Guyana and with whatever more you choose to do on your journey, your medical journey. And I hope to see you again in the studio at some time again talking about TB, because it's something that needs to be spoke about on more than one occasion so the public can actually constantly be hearing this and constantly be getting themselves checked if they have symptoms, etc. So I want to say thank you so much, Unique. And I can find you at the West Demerara Regional Hospital, you said, right?
Right there in the back.
Right there at the back. So guys, there you had it. We were talking about tuberculosis. If you just joined us and you missed it, we have a live stream. It's going to be there on EduPage. My name is Anne-Marie, and the gorgeous Unique Chung was in the studio here with me, Dr. Unique Chung, that is. And this is where we head back into the music. And you are locked into Edu FM, the home of family edutainment, where you're entertained and educated. And it's called Sunday Simmer. So let's get back into that music.
You're listening to Edu FM, the home of family edutainment.